This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
Alberta's doctors have declared a state of emergency. The province has not. But the reasons behind this declaration from the dedicated physicians, the healthcare professionals that are attending to patients daily in ERs, in waiting rooms, and in other healthcare facilities across the province is based on some shocking information. Cases that have been divulged, that have been leaked to journalists, including this talk show from an anonymous source, and we're going to get into that today. You will not be shocked to hear that Albertans have been waiting for care because that has been the reality for several years. Remember, Alberta's government, the UCP, led by Premier Danielle Smith, promised to fix healthcare in Alberta in a shortened time frame, in 90 days, when Premier Smith assumed that role after winning the leadership of the party. Of course, many, many days have passed since then, and as the leaked report confirms, really nothing has improved. Albertans are literally dying waiting for care. And there are dozens and dozens of near misses. You'll hear about 6 cases where people ultimately saw lives end, where loved ones have mourned the loss of someone waiting for care in an ER, in a hallway, in triage, waiting to check in, waiting for testing, waiting to be admitted. But there are many, many more cases where Albertans have dodged a bullet. Dr. Paul Parks, past president of the Alberta Medical Association and a longtime ER doc, joins us in a very important episode of the show. That coming up in 30 seconds. This show is happening with the presenting sponsorship from RapidX Financial. You know, the crypto world moves fast, but your trust in an exchange cannot be a gamble, and that's why we're proud to partner with RapidX Financial, a made-in-Alberta solution backed by the same experts that have rolled out those rapid cash ATMs you've seen all over Canada for the last quarter century. RapidX makes it easy to get started with 3 different ways to trade. You can use their physical crypto ATMs. You'll see those. They have an over-the-counter desk for discrete, larger value trades, or if you have questions, you want to bounce them off a real human in person. And then they've got that secure online platform at rapidxfinancial.com. And Real Talkers, because you're hearing about RapidX on the show, there's a special offer for you. When you go to the website, rapidxfinancial.com, and use the promo code RYAN50, RYAN50, all one word, you'll get 50% off fees for all of your online ER, or rather the e-transfer trades. Sorry, guys, Freudian slip, getting ready to talk healthcare. All of your Interac e-transfer trades, 50% off fees with the promo code RYAN50, RYAN50 at rapidxfinancial.com. Now, you may have questions. You can check out the links on the website to get answers to those, but let me get to a couple for you right out of the gates. RapidX Financial is secure. It's FinTrack registered, and critically, it's non-custodial, meaning that you're always going to control your keys. That's a big deal. If you don't control your keys, that should be a non-starter. And that's why we encourage you check out rapidxfinancial.com and use the promo code RYAN50. Well, let's get right to this. Alberta's doctors have declared a state of emergency. Alberta's official opposition, the NDP, urging the government to do so to this point. That has not been done, but if you're like me, you're probably listening to the experts on the front lines. If you want no-holds-barred analysis of what the reality is. I have in my hand a copy of a report leaked to journalists across the country that details some of the tragedies that have unfolded in emergency departments across the province. We wanted analysis that is informed, that is credible, and of course, that's when we turn to Dr. Paul Parks, past president of the Alberta Medical Association. Doctor, thanks for joining us. I know you're always happy to do interviews, but I know that this is subject matter you'd rather not be talking about. Where's your head at right now?
Yeah, well, let me jump off. Thanks for having me here, Ryan, and say, yeah, it's been a busy couple of weeks. Lots of interviews talking about negative stuff here. I should just say it's not my real job to be advocating here. I'm not my job's to be in the front lines and do emerge care. And I've just spent 10 shifts in a row and It's been busy and doing lots of media and trying to advocate too. And maybe we're going to probably talk about, well, we are definitely going to talk about where the system's not working and what we need to do to fix it. But let me just say, like, the reason I'm advocating is when the system works well, and I'll agree with the minister and people. When you get in and it works well, you get world class care. Like, for example, recently I had someone in their 50s present to my emergency department while I was on, and rushed into a care space because they had chest pain, seen within minutes, got diagnosed with a big heart attack, got clot buster, state of the art medicine within 12 minutes. Got on an airplane in a fixed wing and flown to Calgary within 90 minutes, got put on the diagnostic table where they did an angiogram and put a big stent in there, and saved that person's life. And we do that routinely when the system works. And that's why I'm here talking about why we're pleading and begging with the government to help us be able to take care of those life and death-saving type cases that we know we can do.
Okay, I want to set the table for this discussion. We'll call it a reality check, I guess. I want to read from this report that was provided to us. Most folks will recognize that we don't reveal our sources, but I will reveal or clarify who my source is not, and that is you. You did not send me this document, but I want to read from it. The title, Alberta Emergency Medicine 2026 Suboptimal Cases and Outcomes. It says these represent a sampling of what we've been seeing over only the last 2 weeks, and truly are only the tip of the iceberg as to the immense suffering that's occurring. They're being shared with the hopes of spurring clarity on a shared understanding of the provincial crisis we're in, the province-wide crisis we're in, a definition as to who has provincial leadership to take us through it, to lead us through it, as well as understanding what exact mitigation strategies are being employed to stop the suffering and deaths. It's a lengthy document. I'll just read, and it almost feels calloused and cold, Dr. Parks, to read it in this way, because we're talking about people's lives and people's lives who have ended. But case number one, the left without being seen tragedy. A man in his 50s presenting to an urban emergency department in the evening with a fever, a sore throat, left without being seen after an 8-hour wake, admitted after the fact to an ICU with strep bacteremia, care withdrawn ultimately due to multi-organ failure, the patient passing away. Another one, delayed diagnosis of a bowel obstruction. A female patient waited over 8 hours on a night shift to be seen. A bowel obstruction perforation required emergency diagnosis in the middle of the night. By the time she was seen, septic and very ill, ended up getting emergency surgery, but succumbed to her illness 24 hours later. The death zones, they're being described. The hallway cardiac arrests at a tertiary care site. A patient waiting in the hallway, offloaded by EMS, no nurse assigned. Due to these mandatory offload policies, others being cared for by EMS in a suboptimal crowded space, that patient suffered a cardiac arrest in the hallway and died. There was an out-of-hospital arrest, a patient suffering an out-of-hospital arrest, dying on arrival to the emergency department, had complained of chest pain for months and had presented to an urgent care center but left without being seen due to long wait times. A sudden death while waiting. An ill but initially stable patient awaiting a GI assessment, no admission capability. In other words, nobody available to see the patient due to overcrowding. Waiting in the ED, the emergency department, for nearly 24 hours with multiple physician handovers, never saw a consultant and ultimately died. And then a waiting room arrest, a middle-aged gentleman with chest pain, triage category 2, a normal ECG, ongoing chest pain. The family had come to the desk multiple times. Most folks are familiar with this story, a tragic one on the 22nd of December. The patient waiting for 8 hours, the family upset, staff trying to de-escalate the situation and calm the patient who was agitated, went into cardiac arrest and could not be saved. 6 Albertans, this is just over the past 2 weeks, dying waiting for care, and they're saying this is just the tip of the iceberg, Doc.
Yeah, well, I gotta start by saying this is tragic. Those are human beings. Those are Albertans, and those are people's loved ones. And I gotta say, of course, it's horrendous for the families and the patients, but it's also horrendous and very difficult for the teams day in, day out to be seeing that. I want to say that, I collected those cases from my colleagues because right after Mr. Sri Kumar's tragic death that was very publicized, many reached out to me and said, like, Paul, like, but for the grace of God, there go I and my team. We're seeing that every day. It could have been us in the media that the case was being talked about, or us experiencing that very, very demoralizing and really difficult experience where we know if we could have got to the patient sooner, we could have saved their lives. And so we wanted to, actually, stats don't matter anymore. There's so many stats, ALCs, EIPs. Like, the government has endless stats, and I mean, even the minister saying, well, he's throwing out a stat, only 0.07% of patients that come to emerge die. Like, come on, man. Like, these are people that are living, and the stats don't matter. So we wanted to put a human face on it, but I gotta say that we have to protect confidentiality. We can't share these stories so they're identifiable in a way. And even, the minister, for example, I think just yesterday, day before, said, there's ways to report them internally. We report them internally all the time. We should send them up the chain. But I got to say, it gets so common that you'd have your nurses, as an example. A triage nurse could spend half of her shift just documenting the bad things she's seeing, instead of trying to take care of the patients. And so I just, maybe that last case you just gave, let me just explain to Albertans, like, what we're talking about. That case was not Mr. Sri Kumar chest pain case that everybody heard. It was another one, almost the exact same.
Oh, pardon me.
And it's important to just say, everybody out there is like, well, why wouldn't the doctor bring that person in with chest pain? They're very skilled, they're very knowledgeable, they know these people need to get in a room. In a perfect functioning emerge department flow, every chest pain would be in a bed and seen by a doctor within 30 minutes. That's aspirational, but there's no emerge department where we'd let people wait 6-8 hours. And as one example, that later case that you talked about, that could be an example of someone that maybe was very similar to Mr. Sri Kumar. I'm not talking about his specifics because I didn't take care of him and I don't know the details, but it could be like a dissection, which is a tear in the big aorta of the big artery that comes out of your heart. And unfortunately, that one, it can be difficult to diagnose. Your ECGs look okay. Your blood work, a troponin you do in the waiting room, is normal. It requires you to get into a space, get it onto a monitor, check your blood pressures on both arms, have an expert take your history and physical, and really quickly say, wow, this could be a tear, a dissection, or it could be a blood clot, but I got to get you off to a special imaging. I've got to do some very specific things really quickly. And I need a nurse who can do one-on-one, very specialized blood pressure medications and certain things that'll get your blood pressure down, get you to a CAT scan, diagnose, oh, that is a tear in your big aorta. If we don't fix this in hours, it opens up, you die instantly. And then that means maybe at the center you're in, we got to get you to another hospital that can do that special cardiac surgery. All those things have to be done in a very quick, time-sensitive manner. And on any given day, maybe when that case presented I'll pick a place like maybe the Royal Alex, where they have 65 emerge beds. We're talking about regularly every day in our functioning in the last year, that they might have 60 patients admitted, strokes, pneumonias, cancer patients, heart attacks. They're admitted and cannot get up onto a specialized floor up on the wards because they're overflowing, and the teams are too busy to even be able to come down and see those patients. They're stuck, stranded, and emerge. And then there might be 15 other patients in overflow in other beds waiting for consults. There is literally no space to move those sick people in. And that's what we're pleading for, because it's not just one emerge department. It's all of our big emerge departments. And it's not just the last couple of weeks because influenza has really made this worse. It's been like this for over a year at least, if not longer.
What was different, or what has changed over the past year? You're saying it's been like this for like a year. Now, I know you're not going to say it was perfect 18 months ago, but what's been the biggest change?
So I'll say right off the get-go, this government inherited a lot of difficulties of 20 years of not not planning around workforce and capacity. The minister himself said this. Minister Jones stood up and said, "Yeah, we failed on capacity, us and previous governments." He said these words. So I'm not being partisan but we are right now currently, Ryan. Like there is no way, as in the Edmonton area, for example, that you can take care of a 2026 population with a bed base that's less than 1988. That was the last time a hospital was built, and they actually blew up some beds in between there. So we have a massive population growth, people living way longer that are very sick, then you have all of those things build up over a long time. But for what's different, and what to answer your question, in the last 2.5 years, this government has spent the entire effort, all of their energy, to disintegrate our system, to break it apart, to put it into silos, to create 4 new ministries, and their intent is to make it better by doing that. But it's been 2.5 years of endless chaos, to the point now where over the last year, while we've been having these massive overcrowding in our merged departments, that is bottlenecks down in the hospital, that's due to alternative level of care patients that we can talk about Minister Nixon's confused and misguided ideas around alternative level of care just the other day even. But those bottlenecks have been growing and growing, and there has been nobody. Now that they have 4 ministers, 4 silos, nobody is in control of the entire system. Nobody is the person that you say, "Hey, listen, we are in disaster mode, crisis mode," whatever you want to call it. In Edmonton zone, for example, there is no one that can do operational decision making in real time that can help them out. We used to have IOCs, we call them integrated operational centers, that were in Edmonton and Calgary, and then connected by AHS through the whole province, that we could do provincial methods to distribute and really help us in the disaster. Those are gone. Government blew up AHS. They blew up anything that would be organized and controlled in the system, to the point where Minister Jones 2 days ago, or maybe yesterday, it's been so long, I'm mixing up when all these press conferences were, but he literally said, "Yeah, I'm just realizing there is no one in day-to-day operational command and control style. We have some in Edmonton, some in Calgary, but we haven't been able to do it." And that's what we've been screaming and begging and pleading for.
All right. This is, I know that this is obviously difficult for any physician to hear. We've heard this from other doctors on this show many times, as a matter of fact. The stories of an individual that attended an ER, that showed up. And I think most people are wired in a way that by the time you're in the ER, you've exhausted all your other options. You've decided, or someone that cares deeply for you has decided on your behalf, it's time to go to the ER. There's hours and hours spent waiting. Then the individual leaves, and then their condition progresses and they end up passing away. Whether or not they're brought back to hospital in ambulance or what have you, the patient has left, returned, and ultimately passed away. What's the impact of that on an emergency doc?
So we use words like moral distress, and honestly, it's devastating. Like I got to tell you, so one of the things that, as this say, you asked to what's got changed over the last year, making worse. Well, one of the things is our workforce, our good seasoned nurses. I got to tell you, Ryan, like probably one of the worst jobs you can do in the hospital is to try to be a triage nurse, try to be that person in the emerge where, and I'm not making this up, there's days where the Royal Alex, for example, has 110 patients in the waiting room. That's registered. So they'll have family members with them. They'll be, and not all of them are life and limb death, going to die immediately if we don't get to them. But all of them have symptoms or things that need to be taken care of. Many of them have 10 out of 10 pain. Many of them have families that come up and say, "Hey, please help me, please help me." And the nurses can identify that, yeah, we need to get them some care and some pain meds, and we need to go and to get busy and bring other people in because they're sicker, doing their job, going, and then 6, 7, 8 hours later realize that person's just gone home, left. And then every single day, all of us are hearing stories of like, well, this patient came back here now with, they had 10 out of 10 abdominal pain. They waited hours and hours, and it's not, some are really frustrated. One of the cases you mentioned, and again, I should say, you're mentioning, you read out just some of the obvious deaths. We have so many near misses, but one of the cases you mentioned was someone that's like they're confused, they're a bit delirious, they're not breathing right, they have an infection. Can you imagine sitting for 8 hours and not getting care and being like, I got to go home? But when they come back, we hear these cases again and again of that they come back, almost dead or dying, and we can't help them. And we know we could have if we had the capacity and the workforce, and we had the attention of the government to help us out. We know we could help these people out, and that's why we're pleading and begging, because we'll lose those nurses. We're losing so many good emerged nurses that are saying, listen, I mean, even in the last couple of weeks since I've been advocating, I've had many emerged nurses reach out to me and say, Paul, I've done 20 years of emerge. It's never been this bad. I've left. I've gone. I'm going to go do home care. I'm going to do this or that. I can't tell you how awesome a 20-year emerge nurse, their skills and how great they are. And when we lose them, they're so hard to replace.
Yeah. I don't have time to read through all of these cases, but like this will give people an example of what we're talking about. Again, these are compiled over the last 2 weeks. This isn't the last 2 years in review. These are the last 2 weeks, right? A pulmonary embolism in a hallway, a patient examined standing up as there were no stretchers available for this patient experiencing chest pain, and tachycardia with suspected pulmonary embolism. We're getting out of my wheelhouse, but an aortic dissection in the waiting room. A 50-year-old waiting 8.5 hours with chest pain, a 50-year-old female. A 24-year-old with an intentional aspirin overdose and depression arrived in a severely crowded ER and, sat in the waiting room for 4 hours there. A myocardial infarction in the waiting room.
That's a heart attack.
Okay.
A heart attack.
Yeah, let's call it what it is. A ruptured spleen in the waiting room, subarachnoid hemorrhage in the waiting room, a female in her 50s, septic shock in the waiting room for 7 hours, a male in his 20s experiencing influenza, an infected spine, a patient in his 30s with an infected spinal cord waiting 9 hours to be seen. And the list goes on, right?
It's endless.
No pain meds for 9 hours for a cancer patient in her 20s waiting 9 hours for pain control. Hey, let me ask you about the culture of this, first of all. Nobody thinks that private medical records should be released. Everybody understands that in particular when it comes to healthcare and finances, and you could probably throw in education as well, people's personal records need to be protected all the way to the wall. What sort of a risk does the source here take in releasing these case studies to journalists, including this show?
Well, there's a couple. So obviously, one of the reasons that I collected them from my colleagues is so there's a bit of a buffer from what site it is at. So you don't necessarily know what site it's at. You don't know what day it was. You don't know what team member took care of it. Trying to protect that way a little bit. And again, everything you just did that you said there. There's a lot of medical jargon in there, and we do that a bit intentionally too, to just kind of not have some identifying factors in there too. And I got to say that everything you read, I want to these are just examples of really bad things we're seeing every day that my colleagues have sent me, because they have for every one of those, there's 10 that have 10 out of 10 pain, or a 2-year-old that's having trouble breathing for 10 hours in the waiting room, and the parents are terrified. Is my kid really sick and going to die, or is this a virus and I can treat it and go home? So we're not even talking about that kind of suffering every day, but the risk is real. And I got to say, Brian, I was extremely not surprised, but my colleagues and I were very disappointed with the government's response to send out the PR troops and say, they had these cases. And as we were talking about, begging for help and saying, I don't want to argue semantics with the government anymore. If they don't want to call it a state of emergency or a state of crisis or a state of disaster, and they wanted to say that it's extreme pressure, I don't care what you call it. Let's put some solutions in, and I can talk about those. But they had these, and they knew about this, and they come out and say, these doctors they're misguided, and everything we possibly can be doing, we're doing, and we do have provincial coordination, and they essentially call us liars, and actually are downplaying our concerns. That's what they did, and they took 10 days before they came out and had a press conference. And did they say, "Oh, we messed up"? Actually, they were correct. And there is extreme pressure. They weren't misguided. No, they didn't. And again, we're not asking for apology. I don't want to argue semantics, but That is why these cases exist and why I collected them and sent them to the people who are decision makers, because they basically were gaslighting us and saying, it's not a big problem, and that's a concern, and that's why all Albertans should be aware of this and be talking about this. And one of the things that I'll tell you too, there's this discussion about lots of, we could talk for hours, Ryan, there's lots of discussion about, well, private pay and being able to pay for your care, and going down that route, will that help the system? I can tell you, you can have $50 million in the bank right now, and if you're having a stroke, or if you're having severe chest pain and a heart attack, it's not going to help you one iota in our overcrowded emerge departments. Or if you have cancer and you need to get urgent cancer surgery, or if you have a trauma. So my colleagues just a couple of days ago in Edmonton zone, the trauma orthopedic surgeons are talking to me and saying, Parksy, our list for our complicated, really bad trauma patients are over 25 long now, that are sitting days in our hospital because we have empty ORs that we can't get in there at. So I just want to stress that you can have lots of money, but if the acute care system isn't there for you when you or your loved one in your time of need, it won't mean anything.
Every case here is relevant. Every case here is important, but I know how people feel when children and the elderly are not being looked after. Of this list provided, a delirious senior in a waiting room, a delirious elderly patient. Imagine it's your mother or your father, your grandmother, your grandfather, and a delirious elderly patient in his 80s, waiting more than 8 hours to be seen. Around midnight, a woman in her 80s sitting in the hallway in a wheelchair, known to have a pelvic fracture and unable to cope at home due to pain, too weak to shift her weight, was still in the waiting room 5 hours later when the wait ended. A woman with a broken pelvis in her 80s sitting in a wheelchair. What about a patient that sat with an empty oxygen tank in the waiting room for hours? What about the stabbing patient that was resuscitated in a triage stretcher, not in an appropriate setting, but resuscitated in a triage stretcher, transferred to a trauma department at another site, never got a room in the department? What about a paraplegic patient that was sent home after 14 hours in a bright hallway with no privacy? What about the stabbing patient here? I mean, that's a wild story, doctor. The stabbing patient.
Yeah.
Let me ask you this, and I know you want to say something, and I'm going to get out of your way, but I'm in a profession where a lot of people will say, well, talk show hosts, their job is to rile people up. They put clickbait out onto social media. Talk show hosts are inflammatory and sensational. Physicians, I mean, you guys take this Hippocratic oath. You spend the better part of 15 years in post-secondary to get to where you are. You make all kinds of sacrifices. The compensation is fine, but probably not enough based on your schooling and your expertise and what you do. How does it make you feel when you're gaslit? How does it make you feel personally when it's implied that you and your colleagues are not accurately discussing or reporting what's happening in hospitals?
So I'm trying to phrase my answer without swearing here, Ryan. It's unbelievably frustrating, and I gotta say, and I'll say it again, and I'll say it to Minister Jones' face directly, and I don't give a shit about what you call this. I truly don't. He gets out there yesterday and says the system's not collapsed. Ryan, I'll ask you and Albertans what you just described, when I'm telling you that that's one out of hundreds of cases. They're just giving examples. What do you call it then? What do you call it when we have mandatory offload of our ambulances? So I want people to understand that we've had this for over a year or two. This is to try to get our ambulances back on the street so they can go to the next emergency, so that people don't wait hours lying in a snowbank with a broken hip to get an ambulance to come care for them. They now just dump the patient regardless of whether we have a space. And I'm using the word dump because that's part of the protocol, is just they go in the waiting room or they go in a hallway space. They go wherever there is a space and they leave. And then our teams might have a stabbing patient, for example. It's a stab. Then we got to be pulled out and go to the triage room, like a little bed off the waiting room, to try to run that resuscitation and send the patient somewhere. Or, as you said, how could any emerged nurse let an oxygen tank run out in a waiting room on someone that's sick. Well, that case, as an example, I know it's someone in their 30s, very sick, short of breath, never on oxygen before. That's a sick person that should be put in an emerge bed right away. There are no emerge beds. There are no EMS offload areas where nurses are around and can look. They get put in the waiting room, spend hours, and the oxygen tank runs out. And nobody is able to go back and reassess them in a timely fashion. So now the government wants to implement putting a doctor out there. We've been begging for it for over a year. It sat on some bureaucrat's desk. They didn't move on it because we said, hey, this will be a Band-Aid that will help a little bit. And please move forward on this. Please do it. Please do it. So then we come out and say, hey, we're in a state of crisis. Please help. Like, here's some cases. Here's some really bad stuff. And all of a sudden they're like, oh, well, maybe we should act on this triage liaison physician and this doc to go around and see, oh, is your oxygen tank empty or not, after they gaslit us, Ryan. So I want to say, like honestly, and meanwhile too, our premier likes to talk about every topic like an expert and be out there. Her silence is deafening, man. The fact that she hasn't said a peep about this while people are dying in our hospitals is really concerning and should concern Albertans. And we do have ideas and we do have solutions. I'm not just sitting here pissing and moaning. We were begging for them to do an operational coordinator, provincial control. I phoned people that are at the senior levels of ACA, our new acute care Alberta, asked them, said, who's doing this? And they're like, well, I don't think it's us. We're governance. Asking HS leads, Covenant Health, who's doing this? Like, these are my buddies and people I know for 25 years in this system, saying who's doing it, and they're all like, nobody. And then we say that and government says we're lying, and then comes out and says, oh, actually maybe they weren't lying. Maybe they actually don't say those words though, Ryan. They say, yeah, maybe there isn't coordination, and they don't actually go back and say, yeah, we were misguided in saying that the healthcare workers were misguided.
Yeah, I've been hosting talk shows for better part of 20 years. I've never heard a politician use the word lying unless they're hurling the insult toward their political opponent. Dr. Paul Parks is our guest in our feature interview presented by Mercedes-Benz Edmonton West. Hang tight. I want to talk solutions. Plus, I got to ask you if this is maybe the time of year factoring into this flu season. Don't answer it now. I want to get to our live chat here real quick, powered by Park Power. Erica says, at this point, I'm willing to look outside the box, inside the box, around the box, beside the box, and under the box for solutions that shorten wait times but maintain a high level of care. Tracy says, let's not forget about the morale that we see deteriorating in the public sector workplaces. It's harder and harder to find job shadows. Ruth says, experienced people in the field have solutions, but political ideology is blocking real, tried, tested, and true solutions in exchange for political ideology instead. Emily G, thanks for your YouTube membership. Emily says, last time I was in a waiting room 5 years ago, I lost consciousness, had to be resuscitated, rushed into surgery. Boyle Street Curse says, in normal times, people dying in hallways would end the political and private careers of health ministers. Government would be polling under 20%. Instead, we have a bunch of groomed sheep. Kathy says, maybe it's time for politicians to get out of the way and let the people doing the job all day create the solutions. Tracy D says, I'm quite literally terrified of needing emergency health care right now. I assume I won't get care if I need it. This is Alberta of today. It's dystopian. Super Chat Ken kicking $5 into the Super Chat says, Dr. Parks has been relentless in trying to improve health care. Actual public service given from his heart without compensation or a fat salary for his service with the Alberta Medical Association. More from our live chat powered by Park Power. More with Dr. Paul Parks in just a moment. If you're listening to this later, send us an email to talk@ryanjesperson.com. You can send it anonymously if you like. We'll respect your privacy. You know, we mentioned Park Power powering our live chat every single day. You can find them online at parkpower.ca, your friendly local utilities provider with electricity, natural gas, and internet across the province of Alberta. If you want to maintain quality utility service but keep more money in your pocket, check out parkpower.ca. They're so confident you're going to like what you see. There's no cancellation fees if you decide to bolt. Plus, what I love, you avoid the awkward conversation. They'll break up with your existing provider on your behalf so you don't have to do it. And you can also choose your charity. When you bring your business over to Park Power, they share 10% of their electricity profits with local Alberta charities. You can check out their partner charities online. Pick which one you want to support with your business. You'll find customer reviews on their website. And if you check out parkpower.ca/realtalk, you'll find exclusive promo codes You can save $150 off your first bill if you bundle services at parkpower.ca/real talk. Hey, if you like the blazer that I'm wearing today, this is one of my favorites. This is a Luigi Bianchi blazer, and I picked that up at the Helm Clothing. That's where I go every time I have an important event coming up. If I'm going to be hosting in front of 1,500 people, like I will be this weekend at Chamber Ball, can't wait for that. I'll be rocking clothes from the Helm Clothing. You can check out their 3-story retail experience. Johnny's showing you some video now. They've got all of their fall and winter looks out. Soon they'll be switching over to spring. They've got you covered with luxury casual menswear and custom suits. And I want to put on your radar a Damascena made-to-measure event. That's coming up January 26th to 30. You'll see preferred pricing all the way through to the end of January at the Helm. This is designed by founder Chad Helm. This is the most exclusive menswear brand in the market. Step into luxury with custom Damascena suits, sport coats, dress pants, and outerwear. You can book your appointment at thehelmclothing.com. So you invest in new threads. You got to have somewhere to hang them. Got to make sure you don't have the wrinkles. Keep them well organized. That's where California Closets of Canada comes in. Custom closets and storage solutions for the entire home. We love our California closets. I keep my cufflinks organized. I keep my accoutrement organized. You know what I'm talking about. The lapel pins, the tie pins, all that important stuff that gets buried in junk drawers and forgotten. Not when you've got a custom California closet. They also do bedrooms. They can do the guest room / home office. They can do custom garage storage systems, entertainment centers, boot rooms, laundry rooms, and more. There's no limit to what they can do, and they can work with any budget as well. You can find the details. Request your free consultation today at californiaclosets.ca. And our friends at Friesen Brothers reminding you that they, in 16 different Alberta locations, continue to ensure that Alberta families can put good food on the table. And a big part of that is stretching your dollars as far as they can go. Make sure you circle February 1st on your calendar. Be here before you know it, Real Talkers. That's your next chance to save 15% on all grocery purchases, $75 or more. They've got that new pork and apple sausage out for a limited time. I picked up a pack before I headed to my parents' this past weekend down in Calgary. Made a brunch. Those sausages absolutely slay, my friends. Just beautiful stuff from our friends at Friesen Brothers. I recommend pairing them with the sourdough cinnamon buns. You can learn more details about everything we're talking about by visiting friesen.com. Dr. Paul Parks, our guest, past president of the Alberta Medical Association and a practicing ER physician who's actually joining us just hours after, what did you say, your 10th straight shift in the ER? What powers you, man, aside from your passion and your commitment to public service? Are you a Red Bull guy, a coffee guy? How do you do it?
Extra coffee. Yeah, and a bit of stupidity for sure.
Well, it's unbelievable, your advocacy continuing. I know that a lot of people are wondering if this time of year is exacerbating these wait lists in ERs and like it's flu season. Obviously, the flu can manifest itself in many different ways, many different symptoms, impacts on people depending on their existing state of health. Is this worse because it's flu season?
Oh, no question. So, I mean, but it's not just because of the flu season, and it's not just the flu. So, and that's one of the things that, we have been giving data and showing the government. So since last season, last February, as we came out, every winter, we have seasonal variations where we get respiratory viruses. We know they hit. We got really good data where the peaks go up and our volumes go up and our need to admit patients to hospital go up. Since last February, we never recovered from it. And it's been going on. And into the summer, usually we don't have any respiratory volume in our summer and we get some reprieve and things settle down. This August was the worst August we've ever seen in the history of 25 years of me being here, but us collecting the data as a provincial system, I would say. And the government knew this, and then they knew, they were watching down in Australia. So Australia, our summers, their winter. So during our summer, they were getting crushed by a bad influenza, and they knew it was coming. And so here's the thing: I've used this, but I've said it, and it's true. Like influenza was just 1,000-pound brick that landed on the broken camel's back already. It wasn't like a straw, and like it was massive, but everything was broken already. We were going into this where we were severely overcrowded, and we really had no flow way. And what I want to say too, it's very important that I said, this government has inherited that we haven't built hospitals and we haven't done certain things. And over the last 10 years, what we did do to actually maximize and really try to find as many efficiencies as we could, but we also did things like overcapacity protocols and surge capacity protocols, and we started implementing them. And so typically what would happen, you'd have your hospital at 95% capacity, volumes like the flu come in, we surge, we use our spaces, we put people in hallways, and we cope. But for the last year, our overcapacity, our surge, our every elastic, every little nook and cranny of the hospital. Like I'm talking, people are in cubby holes up on the floors. There's people that actually don't have a call bell for the nurse. They actually have a little old-fashioned ding, 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 old style bell to try to ring the nurse because it's not a traditional care space. We've used that all year. So before the seasonal variation came in, we'd used up all our elasticity. When the government quotes, and I think the CEO of ACA said we're at 102% capacity with our surge, with our overcapacity, with our everyday using all of our protocols to try to, what we would call our disaster protocols. When the demand gets really bad, we implement this, we do this, we push people out. We've been doing that every day. And so the flu we've got RSV out there. There is some COVID, like all the seasonal variation just basically put it to the point where there was no give left. And I want to say, we're talking about this and from an emerge perspective, we're just where we own the sins of the system. We're just where anything that doesn't work in the healthcare system gets funneled and ends up in emerge. But my colleagues up in the hospitals, in internal medicine and the hospitalists, they're dealing with, where they would normally, on wards where they would normally have 30 patients, they have 40 or 45. They've added many, many teams, but without as many nurses and pharmacists and physiotherapy and the additional supports they've done. Everybody's gone above and beyond for months to years. My surgical colleagues in the hospital, like I said, have been, their lists are just growing, but they can't actually even get on top of it, where they have people waiting for very complex, fractures of their ankles that they can't walk on, and they're at home for 7, 8, 9, 14 days, and they can't get them in the hospital. Everybody is going above and beyond. So influenza just made it that much harder for us to deal with. And then it just made it and amplified it, where those cases that we're talking about here and that you're seeing, I want to say again, that's so frustrating. The government is their wordsmithing and their PR team is pretty good in terms of their response to all those deaths and near misses is if someone codes in the waiting room, so that means someone has a cardiac arrest and becomes dead in our waiting room. And sometimes we can do all of our skills and make them undead. But they call that when we rush to the waiting room and identify a cardiac arrest and start to try to, reverse what's nearly irreversible. They call that receiving active care. So when you hear about these cases and ask government, well, what was happening? Were they waiting room? Where were they? They're like, oh no, every case was receiving active care, so don't worry about it. So that influenza pushed us into that environment, and it's demoralizing, like I said. And I gotta say too, this government actively undermining public health for the last couple of years and not having a chief medical officer of health and not really knowing that this influenza wave was coming in and knowing our system was so strained. It would have been amazing for them to have somebody out there saying, listen, the vaccines work if you're elderly, if you're frail, if you're this would help our system immensely. And I've been saying this for a long time too. Getting vaccinated is not just about protecting you. It's also protecting the whole healthcare system so that the people who have cancer and need surgeries and have heart attacks actually have a functional system to go to.
Parksy, we got a lot of comments here in the live chat I want to get into, and many of them are themed around sort of jurisdictional realities. Wise Kyle says, as a young guy who's had 2 heart surgeries and 2 trauma surgeries, all under the UCP's governance post-COVID, things are fine. He says, to me, it all sounds like one zone has a big issue, and maybe it's just a dirty zone. I saw Christine earlier in the show say, I'm pretty sure, I'm paraphrasing, I don't see her comment, but she said, I'm pretty sure that, BC has a pretty similar reality. Boomshanker X says, let's not forget that healthcare is failing right across the country. How much of this is Alberta specific or even zone specific, like Kyle's alluding to, and how much of it is a reality across Canada, as far as you can tell?
I mean, I participate on on the national level on this stuff as well from a merge perspective. So I have some good insights, but I'll go back to where I started at, and I will admit, I started at the top of the show saying, when you can get into our system, I agree. You get some of the best care in the world, bar none. My colleagues are amazing. The work that the teams can do. Um, and so for people who tell the stories about how they got into the system and got amazing care, that's what I'm advocating for, and that's what my colleagues are advocating for, is saying, awesome, that's awesome that you got that, and that's how it should work for everybody
Yeah.
when they're in a life and limb and or serious condition, and it isn't, and that's why we're begging for help. As to yes, this is a problem across the nation, no question about it. Things around a growing population, people living longer with complex diseases. There is no question we have to have a national discussion around what our priorities are for our healthcare and finite resources. What are the things we're going to say? Absolutely, this is something we're going to prioritize and make sure all Albertans have access to, and and Canadians, and what are some of the things that we're not going to be able to do, or we're going to have to change, or we're going to have to be evolve on, and there are ways to do that, and there are really good ideas, but we've been avoiding the conversation. But now I want to go back to what has happened in the last 3 years in this province. And it always sounds like you're partisan because I'm criticizing the government that's in power, but there's only one government that's running the healthcare system right now and has made major decisions. And this government has decided that they are going to break up the system, and spent the last 2.5 years totally breaking it up, totally reorganizing it, totally disconnecting it, to the point where we are now in a position where we it's worse in Alberta because we cannot coordinate our resources across the province in a meaningful way, because they took that away from AHS. Covenant Health never had it. They put up ACA, which is Acute Care Alberta, that's in a governance structure that can't do operational day-to-day control. They also then took, the solution. 1/3 of our hospital beds in the province, for example, across the province, 1/3 of them are alternative level of care. A quarter to 1/3. It varies where you're at and where you're looking. Those are patients that are acute care is done, but they can't safely go out to the community because they need continuing care, assisted living, long-term care, mental health care, you name it. That a third of our capacity is taken up, but it's in another ministry. It's now in assisted living Alberta, and it's under Minister Nixon, who just yesterday didn't even really, get the definition of ALC correct, and really understand that not everybody becomes ALC. If you get admitted to hospital and we take care of you and you get better, we discharge you. You go home. But if you can't safely do that, you become ALC. Well, the government split these solutions apart. They totally basically just fired hundreds of our senior leaders across the province for over the last couple of years. They just decimated our ability to react when the system gets stressed. And so that's why it's different in Alberta. And just to the last comment, Edmonton has very unique challenges, no question. And one of the reasons is so here's another thing. So these are just factual. This government, the Premier Kenny, but prior to them, put a pause on the South Edmonton Hospital that was going to be built. This government canceled it. That would have been 400 acute care beds that would have been up sometime this year. They made an active decision to do that in the Edmonton zone while they broke apart the whole system. But right now, that Edmonton zone, not only does it not have the right capacity to be able to take care of the acute care patients and their long-term care patients, but they take referrals from Red Deer all the way to the Northwest Territories. They have massive transfer into their zone, and government just broke up all the corridors and changed how that flows. So I just got to say that it's bad everywhere. But Alberta has had really significant different challenges because of the active choices that this government has made in the last 2 3 years. And then, like I said, they've just announced that they're going to allow Albertans to go get private access to imaging and diagnostics, and then maybe down the road pay for care. Well, I'll tell you right now, as an example, just right now, actually Rick Bell wrote about this in yesterday or the day before, about his experience about not being able to get an ultrasound for possibly a blood clot that could be serious. We can't get ultrasounds in a safe and timely manner 24/7 in our hospitals when we need them for sick and dying patients, because we don't have the technologists, and we don't have enough of them. And government's active decision to say, hey, listen, anybody on the street that has some abdominal pain can just pay for an ultrasound. You need techs to do that. They're going to all go work 9 to 5, Monday to Friday. There'll be none left in our hospital, and it's going to just complicate things even more.
I want to thank Harrison for $14 into our super chat. Harrison, that's amazing. He says, don't forget the NDP started work on a new South Edmonton hospital. Jason Kenney delayed it, like you just said, Parksy. Daniel Smith canceled it. The UCP needs to own this healthcare crisis. Full credit to Dr. Parks. A praise report, as my buddy calls it, from Dwayna Bowena in our live chat. Thanks for your YouTube channel membership. Says, Jespo, recently my mom had to go to the ER, discovered she has a heart condition, not great at all, but we had exemplary care. We got answers in 12 hours. Sometimes healthcare is great, and that brings it back to what you're talking about. When you can access the system, the care is phenomenal. Hey, there's kind of this recurring comment. We see it with everything. Grocery prices, housing prices, ER wait times. It's all immigrants' fault. We see that as a recurring theme in the comment sections. I want to ask you directly if that's accurate.
So population growth that you don't plan for is accurate. So it doesn't matter where they come from. They could be born here. And if we just keep booming our population and we don't have the adequate workforce and capacity for it, that's a problem. But just blaming this simply on people immigrating here, I got a couple things there. One, right away, again, let's just go back to the record. I was at Premier Danielle Smith. I was president of the AMA. I was at her throne speech. She actively said she wants the population of Alberta to go to 10 million. She actually wrote letters to the federal government saying we weren't getting our share of immigration. She actually said we want to boom the population. I got to tell you, these people that are coming in here are driving our economy. They're running, they're working, they're doing things. The idea that you'd think, okay, here's what we're going to do. We're not going to plan for the capacity we need in our healthcare system, and we're just going to tell all these new people that are coming in here to work that you can't access services because you're new to the province. That's insane. And I'll say again, I'm not a politician and economist, but you cannot have a healthy, a booming economy if you don't have a healthy workforce. You're not going to get people to move up to Fort Mac or drive our oil and gas industry if you can't get family docs up there. If you have a serious condition and you can't get into their hospital in a meaningful time. So again, I'll just go back to this premier likes to talk on the record about a whole bunch of stuff, but she hasn't said a word about the crisis that we're in around access to our acute care. I want to say that in 2023, we in the AMA and myself personally gave the government a document saying, here's some ideas around acute care stabilization, because we're going to run into this problem. It's going to get worse and worse, and we're going to be here today. Fast forward today, they ignored us. They didn't act on a lot of these things, and they chose to continue doing other things that have made it worse. So again, I'm just quoting and giving factual things that this government has done. And then when we hit a crisis, essentially they sent out the PR teams and said, they're misguided. And I'll also tell you, they're not a fan of me. They think I'm Chicken Little. They think I'm just out there making shit up, really, actually. And I have to say, I'm representing hundreds of physicians that are talking to me daily that are saying, and I want to, let me put a point on this. Sorry, I know it's long, but most healthcare workers and physicians do not want to speak about this publicly right now, Ryan, because they're afraid it's a punitive culture. They're afraid they'll be punished. It's so overwhelming. They don't know how to navigate it. So a lot of them are coming to the handful of advocates that are out there that'll still speak up and speak truth to the government.
Why are you not afraid of blowback?
Maybe another pound of stupidity there too. I don't know. Like I think I honestly, I think my strategy is just try to be honest and try to be, blunt and direct for years and years. And I do welcome, like, if the Minister of Health thinks that, any of the Minister of Health thinks that I'm making things up or that these cases are not verifiable and that we can't, provide information and that they're not real, I welcome. Let's meet with them. Let's talk about it. Let's, I've just tried to be as honest and blunt as I can. And maybe the more I talk about it, I hope that that provides me some protection. But you know what? There's lots of my colleagues that worry.
I don't know. I got 6 pages of case studies right here over the past 2 weeks that would suggest that this is far from bullshit. Leslie says, Dr. Parks is absolutely correct. When I lived in Northwest Territories, I had to travel twice to Edmonton for healthcare procedures. We've been supporting the Royal Alexandra Hospital and the Hospital Foundation over the past number of months as they've been raising awareness and funds through their 125th year. And one of the points that we've been reiterating is that this hospital has a service zone that covers a third of the geography of Canada, which is mind-blowing. Hundreds of thousands of patient visits through every year. That's one hospital in Edmonton's core. I mean, that's just one hospital we're talking about as a reality check for folks. Maxine's watching us live streaming on Facebook, presented by California Closets. Maxine says we need to go to a single point of entry where the patient enters through one system from admission to discharge, including home care and social work. Maxine may know more than me. It's quite possible. But I also, that sounds to me like it could be a bit of a bottleneck situation. What do you think?
Let me just say about the Royal Alex. I want to say I've worked there before, and I did my residency, trained up in Edmonton, and I want to give a shout out again. The teams in those hospitals, they're amazing. They're working insanely hard, and not just emerge docs, like the internists, the surgeons. Like I think people be blown away to see the work that they do and the amazing care they give and how hard they're working. So again, a lot of what I'm saying here and what our colleagues are saying is we're pleading government now. Like the only people that have the power to actually fix some of the big things like workforce and capacity and organizing the system, to get back to the question, and kind of making it streamlined for the whole province with all these transfers and how complicated. Right now, the only people that can act and empower that is the government. So we're pleading for help. And then going back to single point of entry, there are certain areas where that can help. So this is a good example of where, we have good ideas in how to streamline and how to do this, but in this crisis, for example, that's a good example of what we're begging for when I say command and control and having a single point of leadership for this. For example, is that say you're in Northwest Territories right now, or say you're in Hinton and you are very sick. What's happened in the last couple of weeks, and this is real, this is not me just making it up, is someone's very sick in Hinton, calls the Royal Alex, and the Royal Alex gets an emerge doc on there, an internal medicine doc, and says, yes, you're very sick. You need to come here because you need extra care. You can't get there, but we're too full. Try another hospital in Edmonton. Then they call the U, then they call the nuns, then they call the Ms., then they call the surgeon and get the same answer from all of them because they're like, we're dangerous. We got people dying in our waiting room. You can't come here. Well, there's an IOC they created even in Edmonton that is supposed to coordinate some of this, but now they don't have any say for Hinton to say, you should maybe think about going to MedHack because they've got some beds and they've got specialists, or we should fly you down to Calgary. They broke that and got rid of that. That's a good example of one, like a single point of entry piece that worked when we were in crisis mode and that worked when AHS was clearly appointed. You are going to have operational control day to day over Covenant Health, over the hospitals in AHS, over the zone, all the zones. You're going to be able to make some of these decisions. But it's even worse now because now, if you think about surgery, for example, there's hospitals, Covenant Health, there's hospitals in AHS, there's hospital now CSFs that are out in the community that are all run by different people that are not coordinated and connected. And so if you need a special type of bone surgery or general surgery and you're in Northwest Territories, it's hard to find out where to put you now. And if it's life-threatening, it's even harder. So yeah, we have ideas. We have we've done this before. It's not our first rodeo. We've made this work. It's just we need a willing partner in the government.
I want to ask you this in closing. We've gone way past the time that we asked you for, and I appreciate that. I think most people are aware. We've touched on it that Alberta has ordered a fatality inquiry into the death of that 44-year-old father, Prashant Sri Kumar, who passed away on the 22nd of just before Christmas in Edmonton at the Grey Nuns Hospital. The government says it'll create a triage liaison physician role at major Alberta hospitals. You can never ask what you expect the result of a fatality inquiry to be. It hasn't happened yet. It would be pure speculation. But what do you hope emerges, or what do you hope is manifested as a result of that fatality inquiry? And are you confident that it could be a possibility?
So that's a loaded question. Am
It
I
sure
confident?
is.
So I got to tell you, I have a little bit of hesitation because they did an internal review, and as far as I can tell, they rushed it through. It's good. As far as I know, it's good that they rushed it, that they tried to look at it. The Grey Nuns fatality case, for example, as not just a Grey Nuns issue, what was happening around the system, what are some of the big solutions. But as far as I can tell, and as an advocate and vocal as I've been and connected with as the president-elect of section of emergency medicine asking to be involved, as far as I can tell, they're not going to release the recommendations from that internal review. Now go to a fatality review. That's going to be 2 years away. And I'm very, very worried that fatality, they become very legal. You have lawyers, and it's going to be, we can only really look at that one case at that one moment at a time at this. And maybe I'm wrong. Maybe they'll look at the big picture. Maybe they'll let, loudmouths like me come and talk and give some picture and give big, broad picture. I don't know, but it'll be 2 years away before we have any results. And we can't wait 2 years. If we go on this trajectory for another year without serious and significant intervention, that list we gave you, that's the tip of the iceberg. And I can't tell Albertans how big the iceberg is. It's massive how many people are suffering and having bad outcomes, and it'll just get worse. And so I'll say right off the get-go, here's it's a complex system, but here's where a couple things. They can just admit we're in a crisis. They can say, you know what, we've learned that we don't have a great accountability structure of who's going to lead us in this operational, in the acute care world. We're going to define this person, and then we're going to empower them to actually do some of the tools we have provincially to fix the system. And then, but what I want to say is the proof's in the pudding. They get up there all the time and talk, Minister Nixon said, we've reduced ALCs 15%. Minister Jones says, hey, we've done this, we've done that, everything's awesome. You know what? Right away, just put out transparent data. If Albertans want to know the key metrics of how our hospital's flowing and as if this is getting it better, right away, they could put out 3 stats. Don't aggregate them. Put them out by the hospital of what are the EIP numbers. So EIP just means an admitted emerge patient. Someone stranded in emerge that should not be in emerge. They should be in a specialized ward somewhere. Put out per hospital, what are the EIPs by funded base? So that just means how many beds does that emerge have that has staff, and how many EIPs are in that? So what's the percentage and how's it functioning? Put it out today. They monitor it every day. Put it out and show us what the trend is. ALCs, that's alternative level of care. That's patients stranded in the hospital that should be out in continuing care somewhere. They monitor that every day. They have that. Put it out. Tell us how it's going. And then the last is hospital capacity. Put out real hospital capacity. What are the major hospitals? Just to go with the big ones right now. Put them out. Show what they look like right now. Minister Jones has told me personally many times he's a fan of transparency. Put it out now and show the trends. Show whatever the premier finally gets, decides to tell her troops to do and allow us to do and enable and empower us, show that it's working.
I'm kind of frustrated with our Real Talkers in the live chat because I keep trying to let you go, and then they keep making these incredible, compelling points, and then I got to keep asking you more questions.
Keep going, Ron. I could be here as long as you want right now. I'm passionate about this because it's important, and I want Albertans to understand I'm not arguing left-wing, right-wing politics. I'm arguing healthcare. Is it in the right direction? And I don't care how you vote. Do you think we are going in the right direction? Because someday you or your loved ones are going to need healthcare.
Nia, thanks for your channel membership. Nia says, yeah, I'm laughing my ass off at an inquiry by a blame game government. They're trying to find a way to blame the doctors. Nia goes on to wonder whether or not there may be a class action lawsuit from the families here who've lost loved ones or had very negative experiences in the chat. Waddy's in our chat. He wonders, and I don't know that you would know the exact number, Parksy, but he wonders, what's the actual fire code maximum occupancy for the waiting room at the Royal Alexandra? He says 110 people squeezed in there. Sounds like too many people for me. He says it's a relatively small space just from a fire prevention point of view. You're nodding your head.
Oh, we violate fire all the time. All of our fire protocols, we regularly are violating in the hospitals. The government's probably going to argue with me and say no. Oh, we've had fire violations. I'll say again, government likes to argue semantics again for me. So 110 patients registered in our waiting room in the Alex, for example, registered. They're in there. They're in the thing. We have to spill over. They have to go down hallways. They have to go down into like another area outside of the main waiting room. If people have seen that waiting room of the Royal Alex, it is not big. But this adds to our troubles. The triage nurse, those patients aren't in line of sight. You have no idea what they look like because they could be 100 meters down the way in another spillover way. Like I talk to my buddies that are my colleagues that are the chiefs of that emerge, and I say, like, how are you guys managing? How could you possibly have 100 patients in your waiting room, and how are you managing? And he's like, we're not. Like, we are just doing our best to tread water. And then again, as an example, with that example, you have a triage nurse that's seeing the new people. We'll have to add nurses who will re-triage, that will just go on out there and try to check and find people and check their vitals again and say, are you getting better or worse? And then it gets to a point where it's almost, it's absurd because you can tell they're getting worse, but you still don't have a space to get them in. And you're almost like, well, why am I rechecking to see if they're worse when I know they're getting worse and I can't do anything about it? So yeah, and we do violate fire codes, and we do it because we have to, because that's the only way that we can save other people's lives, basically.
I hate to leave this without a call to action. I mean, what you're saying, this is a very grim reality. It's a huge wake-up call. I mean, you've been sounding the alarm for a long time. So have healthcare workers across the province, most particularly on the front lines. But with regards to a takeaway for this audience, what do you want this audience to do about it? I know we'll say call or email your MLAs. Obviously consider your vote. You're saying it's not left-wing or right-wing, but, next time that Albertans vote for the party that you think is making a legitimate commitment to improving healthcare in the province. But today, somebody's going to be listening to this while they're walking their dog, and they're going to be troubled, and they're going to want to channel that energy into something. What would you recommend? What's your prescription?
Yeah, a couple things. So one, start talking about this. Like I said, let's just get away from ideology and let's just look at some of the objective facts and just start talking about it and saying, is it going the right direction? Does it sound right? But then second, like one of the things you've highlighted for us, Ryan, and we struggle with is those stories, we can't tell them as well. We can't share all the details, and we can't actually share as openly the human impact of every one of those cases. We can't tell you about the loved one that sat next to that person for hours worrying as much as you possibly can, or we can't even, I got to tell you again and again, we see many of these cases where patients come into the emerge without an advocate and are in a hallway for a long time and pass away alone and nobody knows about it. We need Albertans to start telling their stories. I think someone's got to help us try to get a way that we can anonymously collect those or collect them in a way that protects some confidentiality or that. But Albertans got to start telling some of those access stories and some of those the real impacts, and start supporting the healthcare workers saying, what they're seeing. And I think I really got to stress this. I think there's always two things that I see. When patients see me finally after a long day or that, they're just so relieved to see the healthcare workers and the physicians and get care and get the great care that we talk about. So they don't want to make a stink. And I'm not telling people to yell at nurses and to yell at us, but they don't usually necessarily think about following up, or they don't want to talk about it because they don't want to seem like they're criticizing the team that did great care for them and ended up taking care of them. I think we're at a point where that's changed for most of us now, and that I think we need more of these stories to get out there. And then again, it does sound like so silly, but the more people out there that say, hey, listen, I'm here and my best friend had a trouble, or my mother had a trouble, or my grandmother, or my daughter, and start just, kind of contacting their government and saying this ain't right. Like, or you live in a rural community and your emerge is closed. Like we have days where Hinton and Edson are closed, and for 400 kilometers area from Jasper to Edmonton, people have to, travel to go in. Start complaining about that. Start talking to your government. But the first is just start talking, get active about this. And like I said, if you can do anything, if you want a meaningful thing of ask, demand the government put those three things up. Just demand transparency of the access metrics for our hospitals, admitted inpatients, the alternative level care patients, and hospital capacity. There's zero reason the government couldn't put that out. They're bragging about their surgical wait times and putting them out. Great. Transparency is awesome. Let's make sure they're doing it, but put those three things out. Everybody that's listening to this, go ask your MLA and the Premier to put those out right now and prove to us that what they're going to do is going to make it better.
Dolores has been watching us on Facebook this whole time and says a big thank you, Doc, for advocating for our healthcare and speaking the truth regarding this government's performance dubious. Says all praise due to doctors and nurses who have kept hanging in there and showing up every day to help people, even though the odds are stacked against them. I hope that resonates with you, brother. I hope you can get some rest today. Thank you for your continued advocacy. Thank you for calling it how it is. Thank you for the real talk. We appreciate it.
Yeah, no, thanks tons, Ryan. Anytime. Let's touch base on this more frequently, and let's hope that they'll listen to us and get moving on some things here. We need help. That's the end thing. Not pissing and moaning. We have solutions. Healthcare workers and our acute care system desperately need help.
That's Dr. Paul Parks, past president of the AMA and still an ER physician serving Albertans. He's joining us just hours after wrapping up his 10th shift in a row in a Southern Alberta ER. And after he talks to us, he'll be right back at it. I've got just a ton of respect for him. I want to thank the many real talkers that have been sharing your stories in our live chat. I know we're going to get more comments on the YouTube episode, comments on Spotify when the podcast drops. You can always send us an email to talk@ryanjesperson.com. I also want to thank those of you that are doing everything you can to ensure that this show sees the reach that it needs to have. I see you, Goramut, in our live chat. I see you advocating for people to like and share the episode. That means a lot to us. I want to thank Ken K, a YouTube channel member who's just gifted 5 YouTube channel memberships, Johnny, these 1-month trial memberships, which is awesome to see that now Just Joe and Plain Power and Lynn and Nick H and Fern have received these gift memberships, which is awesome. Simi, you're $28 into our YouTube super chat. We sure appreciate that. And I see you advocating along with Emily. When I mentioned my blazer that I'm wearing, this coat from the Helm Clothing, I saw the comments. I see you. I see you, Explorer Hollis, saying at least it's not flesh-colored. Hollis didn't love my sweater yesterday. He says, at least this isn't flesh-colored. He says, I'd love to see you wearing coveralls for a show to represent the blue collars that support you. I love that. I can bust out my Carhartts for a day on the show. There's no problem with that. But I see Emily wants me in a teal blazer, and Simi doubled down on that. Simi and Emily, in honor of your great friendship to the show, Simi in particular, your YouTube super chat. Johnny, I'm going to find the loudest blazer that I own, and I'll wear it for tomorrow's show as a reflection of my appreciation for the super chat. The loudest one I have is very spring-like, and it's going to be like minus 25 tomorrow. So I don't know if fuck it. We can do whatever we want, right? I think we can do whatever we want. This really is serious stuff, and it's very difficult to be honest with you when you put yourself and you've been in this situation before, I'm sure, where there are dozens and dozens and dozens of we say case studies here. These are people's stories. Like an 82-year-old or a woman in her 80s anyway, with a fractured pelvis, sitting in a wheelchair, waiting hours for care. That's somebody's mom. That's somebody's grandma. Right? That's a human being who's contributed to her society for decades. Now her society is not looking after her. These are real people. Every single one of these, like on page 6 of this, I haven't even got to these stories. People that are falling through the cracks. Like these are real people. And these are just the worst case scenarios, right? These are just the worst case scenarios. So we do take this very seriously. And we appreciate your feedback and your input on this. If you want to let us know how you're advocating, maybe you bring a different perspective to the table. Maybe you're hearing this from somewhere else in Canada and you'd like to share your story from Saskatchewan or Newfoundland or Quebec. You can find us online. And of course, we do appreciate those emails that you send us. It helps deepen our understanding of what's happening around us. Cary Williams from North Road Investment Counsel is going to be joining us in just a second. What's the difference between a spendthrift and a tightwad? I know for a lot of you, you've probably just received your credit card bills for the holiday season, and right now the family's on financial lockdown, so to speak. You're tightening the belt a little bit. Cary wants to give us a sort of a short-term and a longer-term outlook on how your family can stay on track. That's coming up in just a moment. Of course, not everything is all bad, and we consider this as part of our duty to celebrate the areas where our province shines, where our nation shines. It's Alberta Wins, presented Thursdays right here on Real Talk from our friends at Play Alberta. We've been telling you about the Real Talk Suite we're going to be hosting 21st of March as the Oilers host the Tampa Bay Lightning, presented by Play Alberta, and you can qualify to win 2 spots in that suite by submitting an Alberta win to talk@ryanjesperson.com, and that's exactly what Johnny K did. We're not qualifying this show's technical director for a seat in the suite. This is a different Johnny. It's Johnny K who writes in with an amazing Alberta win. He says, Jespo, I never miss an episode of Real Talk, even if I'm catching it a day or two late. He says, some heavy topics, but always insightful and well done. He says, this is absolutely an Alberta win. He says, we got to look back to this past summer of 2025, but both of Alberta's U18 boys and Alberta's U18 girls football teams won national championships. Both teams went into their gold medal games as heavy underdogs to powerhouse teams from Ontario. He says both Alberta teams were down in their games, and both Alberta teams came from behind to win in overtime. Now, how's that for a storyline? Johnny K says this is the very first time in history that Alberta has won both boys and girls national titles in the same year. Johnny says if that's not an Alberta win, then I don't know what is. He says, now full disclosure, I do have a personal connection. I coach a couple of those U18 girls on their club team in Stony Plain. Johnny K super proud about it. You can read more about both of these overtime national title wins by visiting footballcanada.com, and we want to give a shout out to those U18 football stars that put Alberta on the map, elevating our U18 football programs above anywhere else in the country. An incredible Alberta win. Alberta Wins is presented by Play Alberta weekly right here on Real Talk. You know, a winner in Sturgeon County just scored $100,000 on Cash Machine. There's literally hundreds of popular casino games to choose from, some of them with jackpots worth millions. Plus, a major casino winner every single hour, and all revenue stays right here in the province of Alberta. If you like what you're hearing, you can download the Play Alberta app today to get started with casino, sports, and lottery all in one app. You can also check out the website, playalberta.ca. You must be 18 or over to play, and when you gamble, please use your game sense. You know, probably the biggest mistake that Cary Williams of North Road Investment Counsel has made today is saying to me upon his arrival earlier this morning, Jespo, I got nothing but time.
Don't say that. My team might be watching. They might be like, what do you mean? We're working our butts off here, buddy.
You disclosed to me that you didn't have a meeting until an hour from now, and Dr. Paul Parks was just spitting truth and spitting fire. So anyway, I want to thank you for your patience as you hung out in the Real Talk green room. We're grateful for the insights that we glean on a monthly basis from you and Marshall and the team at North Road Investment Counsel. And we thought, you know, now into the month of January, a few months in, is a perfect time to talk about spending and financial plans, and basically as people sort of are balancing two things. Number one, maybe a New Year's resolution to get on track, and number two, the cost of the holidays. The credit card bills are arriving right now.
Yeah, I don't know about you, but my spending over the holidays was higher than it had been budgeted for.
Mine was higher than budget as well.
Yeah. So, hey, last time I was in, we talked a little bit about how do I take money off of a portfolio in retirement, so really focus on retirement spending. Today, I want to tell you a little bit more about a second book, which is, I think, relevant for everybody. And so the first book I talked about was the 4% rule and some new research around this 4% rule, this idea that pot of money. I can take 4% a year, last me for a 30-year retirement. Now we're saying it's 4.7, pretty conservative still. This one is a little bit more relevant, I think, to everybody. So Tightwads and Spendthrifts is a book I've been reading by a researcher out of the US, okay, Scott Rick. And this talks a lot about what's the psychology behind spending and how does it connect to our relationships. So after the interview you just had, I thought I'd lighten the load a bit. We can talk a little bit more about fighting with our spouses instead of about the brutal state of healthcare at the moment, right?
Let's take our attention off healthcare and focus on our personal relationships. What
a downer.
I will say this, nobody really, I mean, maybe with exception, nobody really wants to be known as a tightwad.
Yeah, I mean, I think that's true, except I think there's a little bit of a almost a moral perspective on, do I overspend?
Yeah, sure.
Right? Like, so there's kind of both sides to this. And I think, he was a bit salacious, I think, in his research by stating tightwads versus spendthrifts around that, because he really wanted to poke people on this. But this is a guy who's done real research around this, and he's created this scale. So it's a spectrum, and the thing that he found is the difference he feels between tightwads, spendthrifts, and what he calls unconflicted consumers is the psychology and the pain behind it. Like, do you find pain when you pay for things, as an example? So a tightwad in his
period?
world, yeah, like do you get that physical reaction, right? And there are folks that this happens for, and sometimes it's anxiety based, like I don't have money, but I can tell you from our practice, we have lots of folks who've been successful in their life, who've saved really well, and then they get to retirement and they need to spend the money and they can't do it. Like, a big part of our conversation is, listen, what kind of joy do you want to use your money to create for yourself or your family or charities or your community or whoever? And can you do it? And there's a portion of the population that can't do it. So I've got a client as an example that I can think of just off the top of my head that loves fishing. Like, this is the big thing in his retirement world. It's like pulling teeth to get him to spend money on a brand new boat. Even though we know from running the financial modeling, he's not going to spend all his money. He's going to die with money, right? But getting him to go and actually put the money down, the 6 figures down maybe on a brand new boat.
Well, it sounds like it's more like $250,000 for a brand new boat. I'm priced out of the boat market personally, but for a lot of people, I mean, this is sort of the same joke. I worked, in the service industry, and people often talked about how they felt like their wealthiest regulars tipped the worst, and then the clap back to that, or the response to that, was always like, they're wealthy for a reason. They got there somehow. Yeah, it's kind of the way you're wired.
Yeah, and I think he touches on that a little bit, and we can talk a little bit potentially about money memories and what are called money scripts and how this connects to childhood, because there is a bit of that research out there. But one of the things I really think folks will find valuable here is kind of two things. One, it's the framing of, am I a tightwad where I have a bit of pain from spending even when I know I should spend it? Am I a spendthrift where I have some pain or some regret from overspending even when I know I shouldn't? Or am I in the middle where I'm not necessarily totally unconflicted, but I'm comfortable with what my family's spending? And in his research, he says, listen, it's a bit of a bell curve. We've got about 20-25% in tightwads in the population, 20-25% in spendthrifts and everybody else. And he gives some tips here. So if you're in a relationship, as an example, he says, where you are, say, a tightwad and your spouse is a spendthrift, as you can imagine, those two psychologies can really come to a head.
Yeah,
right?
sure.
And generally it's the anxiety of the tightwad that really pushes it, because the spendthrift gets to spend and the money goes away and now we've got new things, and the tightwad never gets to go back and get that money back when they disagree. Right. And so he talks through this quite a bit and provides some tips for how, when you're in a relationship, how do you deal with this as a spendthrift and or a tightwad? And then he goes into much more detail around other things, like how do you gift well to your spouse who might be of a different perspective on spending than you?
Yeah.
How do you connect with your children and talk to your children about these things? All of those kind of things. So,
well, I'm just looking up the definition of spendthrift. Someone who spends money wastefully, extravagantly, and irresponsibly.
Yeah.
There's not
much
much
sounds
room.
awful, right? Like,
we all know one.
Yeah.
I might be one. No, but there's no room for interpretation there. Wastefully, extravagantly, and irresponsibly. And then a tightwad is like, we got a buddy years ago. I'll never name him, but he knows who he is. He might hear this. But this was the guy when we'd all go out for dinner. Everyone still had cash in these days, and we'd get the bill, and everyone would throw in for the bill for their portion and their tip. And then this guy would always go, okay, so what do we have in there? before he'd pay. And we're like, nah, because what he would do is he would just make up the difference of what was left, and the server would end up, had we not intervened, would have ended up gotten screwed because the guy wasn't a very generous tipper. Wonderful guy, definitely a tightwad. Yeah. So there's got to be room in the middle between a tightwad and a spendthrift, between somebody who feels anxiety when they spend and somebody who feels nothing at all but joy when they spend irresponsibly.
Yeah, absolutely. And he talks a lot about this. And he says about half the population, when he does his research, is in that group. Right? Is in
the middle.
That
the
in
mushy
the middle.
Middle.
Yeah. So I would say there's sort of 3 tips that I took away from this that I really liked. The first was from tightwads, and his recommendation is, at the end of the day, if you are a tightwad in particular, and you know this, like you know that you would create more joy in your family's life, as an example, if you spent a little more money, he suggests budgeting a fun budget. So you must spend X dollars on fun things every month. The opposite of what we think of as budgeting, which is like, how do I not spend money? How do I save money? He says for tightwads, you got to do the opposite. You got to create the structure to actually go and have some fun. If you're a spendthrift, he does the opposite. He says, what you really need to do is create friction. You need to make it hard to spend money. So he says, go back to cash. If you can't go back to cash, go to debit, where it's coming straight out of your bank account and you get to see your bank account fall down.
Right.
Stay away from credit, because credit is so easy. And never that one button purchase on any of the websites.
Oh yeah.
Right? Like, get rid of that thing. Don't save your passwords, like make it as hard to sign into those sites you love doing if you're a spendthrift. The thing that he doesn't talk about, which is something that my family has created, which has been really valuable. Do you remember, Ryan, when your kids were little, that age at like 4 or 5?
My kids still are little, man. I got a 3-year-old. We're right in it. That's why I'm listening so intently.
Yeah. Okay, so let's go. You might be there at 3. I think it's maybe a little early, but with your older one, at about age 4 or 5, you go to the store. Mm-hmm. And I want that, buy that never ends. You like 5,000 times on a trip to the grocery store, you have to say no, right? Mm-hmm. And to me, that was one of the most frustrating times as a parent. So my wife and I did 2 things. One, as soon as we realized that it was so frustrating, we did allowances. Okay, so that was like our tip to get into allowance, and we can talk about that if you want, about how we sort of bucketed different pieces.
Well, right out of the gates, where did you start at per week or per month? I'm curious.
That's a while ago now, but I think that's not true. I do remember. So what we did is we did dollars per week of their age, but we split it into 3. So we did a spending bucket, a saving bucket, and a charity bucket.
Nice.
And they got little jars. They got them to decorate them, little jars. And we would do it that way. So let's say
5 years old, $5 a week divided by 3.
That's right.
$1.50 here, $1.50 there.
That's right. And we always did it in real cash, in change. So they could see like, okay, here's $1. This is what $1 looks like. Yeah. I get $5. Okay, well, 2 go here and here, and I've got 1 left over. What do I do? That kind of stuff, right? And the 3 buckets are important, and there's some books out there on this kind of stuff, but it's really about getting into the brain this idea of some of it I get to spend, some of it I get to save, some of it I get to better the world with. And this goes down into how do you then educate on charitable giving and all that stuff. We can talk about that. But what I wanted to mention on this idea of like the 5,000 times you say no in a store, okay, great time to start charity, allowance, because then they've got their spending jar. You go to the store, they say, I want this. You say, great, you have money. Do you want to pay it?
Yeah.
I can tell you the first time I did that to my oldest son, he was like, no, I don't want to use my money for that.
Saving
5
up
years
for a
old.
Nintendo Switch.
No way, man. I don't want to use that. I said, okay, well, we're not going to buy it. And he was like, okay. And like the nose stopped almost instantly at that point. Okay. So that's an awesome kind of parenting tip or grandparent tip. But, this idea of like spendthrifts versus tightwads and how we kind of manage this. We want to look at allowance and teaching kids. We want to look at those early money memories, all that kind of stuff. And it does start to connect.
Is that what when you talk about money memories, is that what you're referring to, like the 3 jars? Or are you also talking about watching how your family deployed its capital?
Do you have a first money memory of something like when you were a kid where you're like, oh, this money thing happened to me and I still think about it?
I mean, I guess I've got a million things. You always get me to get personal in these sit downs.
It's way more fun.
I feel like my parents raised us well. we grew up, and I've shared with the audience before. I mean, sort of like, I don't know how you put it, upper middle class. Everybody kind of sort of characterizes their family differently, but dad is a physician, stuff like that. Charity was always big with the family. I remember that. We'd have these others first nights where we'd sit down on Friday nights,
cool.
and write letters to people in other parts of the country supporting World Vision, other organizations, stuff like that. And our family, we had some privileges growing up and some trips and things like that, but it was always very evident to me that that was a special occasion. I even think of the vehicles my parents drove growing up. That's something that jumps out at me. And I was always aware, I think even from a younger age, that my parents could probably have afforded nicer vehicles, but they were always very sort of, I don't know what the word, prudent, I guess, in just driving very practical vehicles. I was always in my dad's ear. I'd see the new Benzo or a Range Rover and say you should get into one of those. And he'd always just laugh and smile and, driving his Oldsmobile around kind of thing. So those are kind of off the top of my head.
Yeah. So two things out of that I want to touch on. The first is values, and how do we have money values? And I don't mean dollar figure values. I mean the emotions and the connection across our family around that. So remind me, let's talk about values. And then the other side is how we watch our parents spend on these things and what we see as kids, right? And so, my first money memory, I can tell you I was about 8, and I remember asking my parents how much money they made, and they were together. And I remember my dad getting upset. And my dad is super even keel guy all the time. And I remember him saying, "You don't talk to your friends about that," and just kind of be taken aback slightly. And then my mom, the teacher, turns and says, "Wayne," my dad's name, "Wayne, he needs to know." Right? This is financial education. This is financial literacy. And my dad taking a big breath and being all right, and then laying it out. Here's how much we make. Here's how much your mom makes. Here's why we don't talk about it in public, and laying that out. And that, I think, is a classic sort of dichotomy that we find ourselves in, right? Money's important. We all know it's important for lots of different reasons. It's really emotional, and yet we're not really allowed to talk about it in public. We can sometimes talk about it with family, but even that can be tough. So what do? Well, a lot of the time we judge it based on what we buy. To get back to your cars. Right?
Another thing I'll say in response to what you're saying is that I was raised, and I still kind of stick to this, never talking about money. I never knew what our house cost. I never knew how much my dad made until I started doing his billing. Once I started working then I knew exactly how much he made. But that was sort of the thing too. We never talked about money. We very rarely talked about politics, ironically. That was kind of part of our upbringing. We're talking to Cary Williams from North Road Investment Counsel. Let me jump into our live chat powered by Park Power. Simi just says, "This is great advice." Ken K says, "I'm a generous tipper. Once had somebody at a large table who not only did not contribute, put extra money back in their pocket." What? Ken says, "I called it out and I never went anywhere with that person again." Ruth says this is fun. She says she loves talking about budgeting. Tracy says, "We used to teach financial literacy in public schools 3 different times over a 12-year span due to its importance." Lauren says, "I don't like to spend on myself, but I love spending on family." Tracy C says that bucket idea that Cary's talking about is so tangible. Others are, how about this from Dubious, who says, "I bet you Visa lobbied to take financial education out of the curriculum." Kathy says, "I saw a video where the dad gave the kid $10 to spend on what he wanted at the grocery store. Once it was gone, that was it. And then that way the kid could understand how to choose what was a top priority for them." Others are sharing, the sort of their dream items and whether or not they would invest in those or spend their savings on those. Bunny Slipper says, "The first time I saw the stocks page in the business section, I was 8 years old and I was hooked." Tracy D says, "I've never owned a new car on the advice of my dad, who has never owned a new car." Meta Modern says, "You want to see somebody who's cash poor? See if they always have to have the newest luxury car and brand name clothes." Jillian says, "Our family has 1 car. People think that's weird. I prefer spending our second car money on my Disney vacation club." I love that. And Bustion says, "My biggest weakness is getting into hobbies. It's really tough when you're tech oriented. Everything's expensive, even if you're buying it used." And Waddy says he does love my blazer I'm wearing today. He says he just bought a new one at Value Village for $16.99. Attaboy, Waddy. Right. So people are reporting their own perspectives.
Well, yeah, and I mean, we started this by saying isn't being a tightwad a bad thing, but you see lots of those comments were on great deals, right? Like that's a tightwadism.
There's
in a way,
great
right?
feeling when you get a great deal.
Totally.
Right? I mean, there's a whole commercial strategy around that. I think of like the vacation websites or the flight deal websites where they have the two people that pay different amounts for the room or the flight and share that. Johnny, do you have like when it comes to like childhood memories, money memories, was there an experience that you had like as a kid or a teen that kind of shapes how you spend or save today?
Not really, but we did have the swear jar at home, which was that was probably my first instance where I realized like, well, obviously it was a negative thing that was impacting it, but that was my first kind of, education into where you could save up. And then we would take the money at the end of the month. Mom would put it in a little account. That's when you still had like, you go to the bank and they put it in a little book. And that was my first introduction to saving. They really should have, I mean, this isn't a big surprise, but they should have more younger education on saving money.
100%.
We don't get it till way late.
How do we not have, credit card education, credit card debt is such a major by the way, how much did it cost you for a swear, and where did the proceeds go?
I don't want to date myself. I think it was like a
$25
quarter, and then it moved up to a loony. Like this was a long time ago.
So your budget was like $25 a week.
I was very well off by the time I was 18. No, but like even when you're younger, like you come out of high school or whatever, and your credit score is great, right? And you take that for granted, but you haven't been told all through high school that like how easy it is to damage that potentially for, years, 7, 10 years. Yeah. And nobody gives you that education when you're younger.
100%. Well, and you have to build your credit score, right? So, I think, I remember the first credit card I ever got was first year university, walking the concourse at a Vancouver Canucks game. And I think I applied for the credit card because they were giving away free T-shirts. Hook, line, and sinker. And before I knew it, the credit limit was like $1,500 or something, nothing crazy, but it was like at the limit almost immediately. And at that time, as a student that spent everything I could find, I've always been a social guy. I've always been very generous. I'm especially generous with money that I can't afford, with money I don't have. But I found myself up against the wall and having to find a way to get that paid down and knocked down, not fully realizing the impact that can have on you later in life.
Yeah, and I think, financial literacy is a really tough thing. I think the research that I've seen is pretty overwhelming that, and you probably have this experience from the bit you did in high school, but really we need just-in-time education around financial literacy. So why teach kids at 17 about a mortgage, as an example, when they're not going to have a mortgage till they're 30? Like all that gets lost.
Sure.
But there are pieces that we can make interesting, and one of the biggest challenges I see is and this is, interesting. We can talk about this a little bit, but there's in the financial investment world, there is a real connection between understanding the difference between chess, the game, and poker. Because poker is about making decisions under uncertainty, which is much more like investing. And chess is about making decisions within a defined box. Right? There's only so many things that can happen in chess, whereas in poker, you just don't know what the next move it really is. Like when that card flips over, what are the probabilities of what it's going to be?
Yeah.
And so in the investment world, there's this sort of move towards, and Annie Duke, who's an author, has really spearheaded a lot of this conversation, at least in my world, that poker is really a better education on how to make decisions under uncertainty than, say, chess. But can you take poker to, kids in school and help them learn probabilities and math around good decision making? I think you're going to get into trouble as a teacher, right? So
you may create the next Daniel Negreanu, though.
Yeah.
you may create the next great Canadian poker star.
Right? Yeah.
The odds are probably pretty low on that, though.
I'm taking us on a bit of a tangent, but I think it connects to this idea of decision making and how do we teach decision making and how do we give financial literacy, right? My son is learning trigonometry right now, and there's some folks in the economics world that are like, why on earth are we teaching trigonometry? We should be teaching probabilities and statistics and decision making, right? Which is much more relevant right now to how we look at the world versus trigonometry, unless you're going to be an engineer, which maybe he's going to be, right? But these kind of conversations around, this is a politics show, let's say around education, right? I think are relevant, and how do we get there? I don't know, but I think from the financial literacy perspective, I think it's much more about how do we drip really effective good information over a really long period of time on kids, right? And how do we make it interesting? So, we've talked about money memories. We've talked about these jars around savings. Can we somehow help to figure out interest rates and compounding? These are difficult concepts. I mean, you even look at the pandemic and exponential growth of viruses, which is a form of compounding. And it's hard for us to really understand as humans what this looks like when we talk about exponential growth.
White Dream says school does teach some probabilities and statistics. Tommy says he always takes his kids shopping. Alberta Girl, reiterating, says financial literacy can definitely be taught in the grocery store. Says my kids always shopped with me. They helped find the deals and helped me stock the cupboards. But none of their friends ever seemed to go with their parents. Interesting here from, what was that great handle that I saw? My Name Goes Here, I think it was, which was awesome. Basically talking about, their family's situation and basically talking about, not necessarily spending up to the cap of what you can afford. It says our household income is typically near the top when we fill out surveys, around household income. Says, but we save, I invest. We have 3 older vehicles. I still bike to work to save money and be healthy. All my clothes are thrifted. When you talk about values, I want to circle back to that. I mean, those are values on display, right?
Yeah.
Like it sounds like that person, if they're at the top of the, if you're talking typically on surveys, depends on the survey. But it's typically like 250, 300,000 plus. That's kind of near the top of those surveys, or $1 million plus, depending on the survey you're doing. Those folks can afford a $2,000 blazer, a $3,000 suit, or $400 pairs of jeans. I can't believe some of the prices now. Absolutely wild. But they don't, because that's not in their value set, right?
Yeah.
It's not capabilities.
Yeah, so I talked about those 2 kind of tips, one for a tightwad, one for a spendthrift that comes from the book. But my own personal tip that's worked really well for our family is around this idea of really solidifying value. So I call it the rich life equation, right? So what are the 3 to 5 things that create a rich life for you and your family? And it's really about, to make it concrete, what are you willing to spend your time and money on, and what are you not, right? And I think being really concrete as a family enables these conversations to happen. So about the same time that we started doing the spending jars and savings jars with my oldest, because he was asking for everything all the time, we also sat down, my wife and I, and kind of talked through this idea. And so for us, our rich life has 5 things, and it's healthier brains. So for the adults and the kids, not just, the kids growing and brains through school, but for us doing things to keep ourselves sharp. It's stronger bodies. So are we playing sports as kids, but as adults, are we working out and taking care of ourselves, right? It's healthier relationships. So what are we doing to spend time and money on our marriage, on our individual relationships with our kids? It's connected communities. So this is charitable giving. This is volunteering. If somebody asks us for help in the community or an organization does, are we willing to do that and put aside other things? And then I think that's 4. And then the last one is fun. We just said, listen, like we only have so much time on the earth, right? Like we're gonna spend our time and money making sure we have some fun with our kids and our parents and all those things. And those are the 5 things. So when we have a conflict, my wife and I, and my kids, everybody knows, like if they come to me and say, hey, I want this thing and here's why I want it, and it aligns with this value you told me is important, I'm stuck, right? I'm just like, all right, spend the money. Like we'll figure it out. Right. And if it's something else, as an example, I still drive a car that is many, many, many years old. And we live on a house that is the smallest on the block. And my one child found that really disconcerting when we were the smallest house of the friend group when, they were 7 years old. But that allows us to do all this other stuff. So we've traveled a ton. My kids have been to a ton of different countries. They play a ton of sports. We spend way too much money on kids sports, thinking of, how expensive things have gotten, but it fits with our values. And so I'm an unconflicted consumer when it comes to those 5 things.
Yeah, I don't know why I'm sort of sitting here deciding whether or not to share this, but we had just an incredible family time over the holidays out in Kananaskis, a treat of my parents, but bringing in family from the island and from Vancouver and from Calgary and from Edmonton, and we all went there, and they treated us to the Nordic spa, and I don't know what it cost, but I can use my imagination. And my mom said something that meant so much, and she's probably listening to this right now going, why are you sharing this with thousands of people? But it was just this incredible moment, and it said something to me about how my parents are wired. And she, I'm going to paraphrase her words. These are not the exact words, but she said, there was kind of, she says, like we really wanted to do this and it was really important to us. And she said, but like also, the money that we spend on something like this is money that won't be there for you guys when we're gone. And I was like, what? I'm like, that is not something that we would even consider. And maybe everyone's wired differently on this, but for me, and I was sure to share this with her, the time together as a family is such an investment with those dollars. Easy to say for me as the recipient, as opposed to the one that's paying for it all.
What a great investment.
But what an interesting thing for her to share on what ultimately led to their decision on whether or not they were going to treat everybody to a trip that I know that none of us are ever going to forget.
Yeah, and may not ever be able to do without them.
That's right.
Right? So one of the other tips he brings in here about tightwads is to reshape spending as investing. Right? And he suggests invest in memories. I'm going to spend and invest in memories because those only get better with time. I'm going to spend, on quality things because that's an investment. I don't have to buy those again for a really long time. Those kind of things is one of the suggestions he has for tightwads for sure. And very similar. In our world, in the wealth management world, we call that conversation you had giving with a warm hand or a cold hand. Right?
I love that.
And lots of folks are turning around to this idea of giving with a warm hand. I think part of it, and let me ask you this. So how much conversation happened about that trip amongst the family prior to finding out you were going? Did mom and dad reach out and say, hey, we're thinking about this.
Yeah.
Would you want to do it? What would you like to do when we're there? Or was it just, hey guys, we're doing this and we're paying?
No, it was totally like, what's everybody's availability? What's everybody's level of interest? Would everyone be, I mean, it's almost a rhetorical question. Like, would everybody willing to give us their New Year's if we were at this location?
Yeah.
And of course it created a great deal of excitement and all, in particular all the moms, my wife and my sisters-in-law and my sister all kind of like got involved and the parents in creating neat opportunities for the kids. And I mean, it was incredible from start to finish.
Yeah. Yeah. I think when I, in our practice, and I mean, even in my own family, when I see conflict that comes about around money, I think in general, the foundation of that conflict is two things and often both in the same moment. It's communication, which no surprise, right? Am I saying the thing that goes into your ears and do you perceive it the way I want it to be? That's challenging at the best of times, right? Two different brains locked in black boxes trying to, figure out what everybody's saying and understand it. And the other is, I think, a difference in values on that end. So you said, maybe some people are wired differently when we talk about inheritances, but yeah, some people might believe that it would be better for them to just receive cash rather than go to Cananask, as an example. Maybe, right? We just don't know. Those are just different values. So having the chance to communicate and get through the barriers of communication and talk about the values of our family and how we're willing to spend money. When my kids are growing up and they have kids, maybe their rich life is different. Maybe they have 5 other values. Maybe, the one that wished we had the huge house is now, whatever, pick your top career for income and has a $3 million home. And that's the value that they want to espouse. I mean, for me, that's not a value. So I sort of hope that they don't, but at the same time, they get to make that choice as an adult, right? Sure. But at least having the conversation around it, here's how we're going to spend our time and money. And let's have the conversation when mom and dad, grandma, grandpa want to create those memories. I think them coming forward and saying, hey, this is what we're thinking. How do we make this great for everybody? Give us your feedback, is trying to address that communication piece. They're already saying, listen, one of our values is bringing everybody together at the same time around this holiday. And we're willing to spend our money on it, right? So they're sort of saying, this is our values, or one of them. How do we make it great for you as well? That's the communication piece, right?
Yeah.
And so money is, it's a metric, right? But at the same time, it's very, very, very emotional. It ties into all these feelings we have around our family and our status and our worth and all those things. And the more we can get away from just, did number go up and get down to what does that number mean for me and how do I communicate it with the people that are important to me, I think the farther ahead we're going to get.
Every time you're on, I'm just scribbling notes for myself. This is great. I appreciate it. Chad F. made an awesome comment in our live chat, powered by Park Power, and he said, there's a difference between being frugal and being cheap.
Yeah.
Right? And I think that's maybe worth thinking about for a second.
Again, this research
frugal
in this book
in my mind is a real compliment to someone. You're frugal. You're mindful about how you spend your money. You value your money and your time, right? Cheap is not a compliment.
Yeah. Yeah. I would agree with you. And I think the sort of second layer to that is frugality is different for everybody.
Yes.
So I can tell you for sure that there are folks that know me and how I spend money that will look at some of my spending and just be like, what are you doing? So for me, as an example, one of the things I will often talk to retired clients about is, do you have a personal trainer? And I can tell you for my tightwad clients, that's a hard no.
Sure.
Like, yeah, I'll go to the Y.
$300 a month, $400
right?
a month. They're not going to spend it.
Yeah. Whereas I go to a personal trainer now twice a week, plus, gym outside of that.
Wow.
Because when I'm 70 years old, I want to be playing volleyball with my grandkids, right? That's like my long-term value is I want to be healthy and enjoying the fruits of this labor that we're doing in our working career. And I don't want to have that to ever be a concern or a consideration, right? So that's how I connect my values today with my future hope, right? In addition to growing money over time. And these are important conversations, right? And frugality is very individual. And he talks about this a little bit in this book. Again, he says like frugal is not the same as being a tightwad. These are two different things.
Again, the book is by Dr. Scott Rick, right? He's a psychologist. Tightwads and Spendthrifts, Navigating the Money Minefield in Real Relationships. Cary Williams joining us from North Road Investment Counsel. You can check out northroadic.com for more on what Cary and Marshall and the team are doing there at North Road. And I mean, you do a bunch of things that a lot of other firms are not doing, including your digital risk advisory, which I love, but also these Mexico workshops. People can check out North Road IC.com/MX events, or we'll just link to it in the show notes. But what's going on here later this month? Well, actually coming up in just a few days.
Yeah, next week. We are hosting workshops in Mexico for some Canadians who are down there. So we're going to have some conversations on tax. We're going to have conversations on retirement, on investing, on foreign exchange. So we're really excited about this. Second year we've done it. And again, to connect it to this spending idea, right? Like, is Mexico worth spending some of your retirement on or your vacation money on? Is it somewhere else? Is this important? Why is it important? Having these conversations with our family to say, hey, this is what's important. Am I going to, become a non-resident of Canada and move to Mexico for my retirement? These are all conversations that really come down to how do I want to spend my money and what do I value?
Plus, can business owners go down to Mexico to meet with you guys and then write off the whole trip? Isn't that how that goes?
Wow.
Yeah.
We'll bring the accountants in to advise on that.
When I talk to you guys, it's always like, you know that you still have to pay for your write-offs, right? You are aware that you still have to pay for it all. To let people know that are listening on the podcast that haven't seen the website on screen, that'll be January 26th at the Marriott Puerto Vallarta Resort and Spa, the 26th in the afternoon in Punta Mita, the 28th of January at the Holiday Inn Resort in Mazatlan, and the 30th of January at the Fives Downtown Hotel and Residences at Playa del Carmen in beautiful Mexico. Again, you can find all the details at northroadic.com. Cool with you. If I know anything about this audience, as soon as we open the door to this, people are going to send in questions for you or Marshall next time you're on. Is that cool with you guys? We'll do kind of like an Ask Me Anything type feature.
I was going to say, we had sort of chatted about whether or not that might be a good fit. And why don't we just ask the audience to put it in the chat today? Like if we came in, Marshall and I, for an AMA with you for...
That'd be cool.
30 minutes or an hour. Like, would that be valuable? Would folks like it?
Well,
and let's see what they say.
Of course it would. And then again, just to remind you and state the obvious, friends, you can also just book your own consultation with Marshall and Cary and the team, whether you're, managing your own or in charge of ensuring that your family's investments are well managed, your retirement planning is being handled by somebody very capable and insightful, or maybe it's on behalf of a corporation or even an association. I mean, I know you guys work with obviously very big groups as well. and ensuring that they're well positioned for the future, including navigating unexpected challenges. You can book a consultation. I heard from a Real Talker by the name of Michael who said he's booked a consultation with you guys. I think it's next week or something.
Awesome.
Tongue-in-cheek, sarcastically, he was wondering how long. He said, guaranteed returns almost immediately. I said, oh yeah, by the time your hour's done with them, you're going to be. So I'm sure that Michael visited northroadic.com to book that. Cary, it's always good to see you. Thanks for hanging out with us for an extended period of time. Like I said, worst mistake you ever could make is tell me you got all the time in the world, because we'll use it.
Awesome.
That's where our values are, is in good conversation. So thanks for this.
Appreciate it.
That's Cary Williams from North Road Investment Counsel. Hang tight with me while we wrap here. Real Talkers, these conversations, this show has happened with the support of our friends at North Road and also other Real Talk partners like the Citadel Theatre, one of Canada's largest and most celebrated downtown arts venues. The Citadel Theatre showcases Canadian and international professional productions, and that includes Death of a Salesman, which kicks off in just a couple of days. Friends, coming up on the 24th of January, Death of a Salesman returns to the Citadel Theatre. It's Arthur Miller's poignant story of a traveling salesman grappling with unfulfilled dreams and strained family bonds, a timeless drama that explores ambition, identity, and the pursuit of success, revealing the fragility of the human spirit and the yearning for validation. It's a timeless classic that has shaped generations. You can get your tickets today at citadeltheatre.com. I want to thank all of the Real Talk Patreon supporters and YouTube channel members that entered our contest. We're giving away 5 pairs of tickets to Death of a Salesman. You will be notified by end of day today if you're one of our 5 winners. Our friends at Solar by Kubi want to make sure that you're keeping money in your pocket so you can deploy to the family memories, the charities, the other initiatives that Cary's just talked about. A great place to start there is a free consultation, a solar quote, that is, by visiting kuby.ca. That's kuby.ca. Now, nobody's getting up on your roof in the middle of January, but their engineers can get to work. Their experts can ensure that you're going to tap into every government incentive that's available to save you money right off the hop. And then, of course, once their engineers get that system designed, their installers, the best in the business, will be on the roof of your corporate HQ, your residence, your farm, you name it. Kubi does it as soon as the snow melts. Again, that's kuby.ca. And for those of you that are maybe feeling motivated after listening to Cary talk about your financial priorities, your values, your charitable giving, let's put UCAN Youth Services front and center. This is an incredible charitable organization that really does amazing work helping young adults from 12 to 25 through 3 different programs out of harm's way and onto a path of economic independence. They're creating confidence. They're manifesting opportunity. We've seen the return on this investment, which is why we're so proud to name UCAN our charity of choice this year. A big part of their fundraising is their UCAN comedy nights. Those run through March, the 9th to the 11th, the 16th to the 18th. We're going to be there in support. Real Talk's got a couple of live auction items ready to go. You can bid on lunch and a studio tour with me if you're so inclined at UCAN Comedy Nights. You can learn more and book your tickets today at ucan.ca. Want to shout out Meta Modern, who hit us up on the Super Chat. Says, my plan for being a tightwad is hoping I can string together 1-month gifts of Real Talk memberships. I love how that's trending and catching on. More and more people getting involved in our live chats every single show. And as the show continues to grow, friends, and as we wrap today, I'll remind you that's due in large part to you, to liking our episodes, to sharing our content, to telling your friends you heard it first on Real Talk. In our next episode, we're going to have an exclusive on new polling out, the reality around provincial politics in Alberta, plus informed analysis of Trump's Greenland deal. That's where we'll go. And your emails to talk@ryanjesperson.com. Have the day you deserve. Talk soon.
Real Talk is hosted by Ryan Jesperson, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lawrence Derlego, human resources Lena Shepard, website design Mike Johnston, voiceover by me, Carrie Skelton, member emerita Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjesperson.com.